So I am assessing for any signs outside the room indicating special precautions, and there are none. Knock, knock, knock. Hand hygiene, assessing for any environmental hazards. Hi, my name is Joanna. I'm going to be your nurse today. Can I see your armband, please? And can you give me your full name?
Jenny Behringer,
And your date of birth?
2/19/1985.
Okay, thank you very much. I would start off by assessing your vital signs. So I would check your radial pulse for 15 seconds and then multiply times 4 for your pulse rate. I would observe your respirations for 30 seconds and then multiply times 2 for your respiratory rate. I would check your blood pressure both by palpation and by auscultation. I would check your oral temperature, and I would ask, are you having any pain today?
No.
So with no pain, patient has normal vital signs. I would then ask you, do you know where you are?
Yes. John Teller Hospital.
And what is today's date?
Thursday, April 20th, 2017.
Okay, and patient is alert and oriented times 3. Now we're going to check your eyes, just look straight ahead. Okay, look at my finger. And patient's pupils are equal, round, and reactive to light at 4 millimeters and are good to accommodation. Patient is making good eye contact. Her eyes are symmetrical, as is her face. She has no facial droop or ptosis. Patient also appears comfortable and relaxed in the bed with good posture and appropriate hygiene. She is dressed appropriately for the weather, and her speech is clear and articulated and logical. Now I'm going to listen to your lungs. So if you can just take deep breaths for me. Okay, and if I can have you sit up. Deep breaths again. Okay, patient's lungs are clear to auscultation with no wheezing, rales, or rhonchi. Her respiratory effort is even and unlabored, and her chest appears symmetrical with her breathing. Can I get you to take a deep breath and cough for me? The patient has good airway clearance. Can I get you to swallow for me? The patient is able to swallow without difficulty. Are you having any sputum when you cough?
No.
If the patient was having sputum, I would ask about the amount, the thickness, and the color. Now I'm going to listen to your heart. Just breathe normally.
I was gonna say, I just walked to the door.
And then I would listen to the apical pulse for 60 seconds. Compare it to the radial pulse. Then repeat listening to the heart sounds with the bell of the stethoscope. The patient has normal heart rate and rhythm, normal S1, S2, no extra heart sounds, murmurs, rub, or gallop. And I would assess radial pulses, which are 2+ and equal bilaterally. Can I see your hands? Patient has less than 2 seconds cap refill with no signs of cyanosis or clubbing. If patient had oxygen, I would assess the placement of the oxygen as well as the settings. Check your PP pulses, which are 2+ and equal bilaterally, and your PT pulses, which are 2+ and equal bilaterally. Patient has no pretibial edema. Now I'm going to listen to your vowel sounds. Patient has normal bowel sounds in all 4 quadrants. Are you eating okay? Are you having any trouble with your diet?
No, I'm doing okay.
Okay, when was your last bowel movement?
This morning?
It was normal?
Yes.
And are you having any trouble urinating?
No.
Okay, if patient had a Foley catheter, I would assess its placement, make sure that the bag was hung on a lower portion of the bed, and I would assess patient's urine for color, clarity, and amount. Now I'm going to palpate for tenderness. Just tell me if it hurts. Patient's abdomen is non-tender and has a smooth and flat contour. Patient's abdomen also appears symmetrical. Now, I'm going to get you to grab my hands, squeeze, pull me towards you, push me away. Okay, patient has 5 out of 5 grip strength in both upper extremities. Can you feel me touching here? Okay, patient has intact sensation and range of motion in both upper extremities and has symmetrical appearing arms with no obvious deformities. So now, push down, pull up. Patient has 5 out of 5 strength with dorsiflexion of bilateral lower extremities. She has full range of motion of both lower extremities and they appear symmetrical. Patient's skin is warm, dry, and intact. She has no obvious rashes or lesions. I would assess her IV site to make for infection and infiltration. I would also assess at this time if she had any dressings or drainage tubes, and I would assess them for possible signs of infection. If patient were on bed rest, I would reposition her every 2 hours and transfer to a chair as necessary. I would also get her any ambulatory aids if needed, which she does not. Patient has no difficulties tolerating movement. I would also assess if patient had any SCDs or foot pumps or TEDs, and if so, I would make sure that they were appropriately placed and on the proper setting. Finally, I would assess patient's skin for turgor, which is good. Then I would make sure that patient's bed was in the lowest position and locked, side rails up, call bell within reach. I would document my assessment findings. Thank you very much for your time, hand hygiene,